wanted to say is that you can have tactile stimulation, and this is processed by the integration center of the spinal cord, not necessarily by the higher brain. So erection can occur without using the brain, basically. And all this would be tactile, and this would be more psychological stimuli. And whether it's tactile or psychological or a combination of the two, the reflex is mediated by the spinal cord. So you know somebody that has, and this is a lower spinal cord, so somebody that has some type of a lesion in the spinal cord or something like that will not be able, I can't remember which vertebra, but they will not be able to have a reflex, this reflex, the erectile reflex, if there's damage to the spinal cord at a certain place, because this is where the reflex is mediated. This reflex is simple. Really comparable to reflexes that you studied for urination and defecation. So it's a similar type of reflex processed by the spinal cord. Now, one of the things is that the spinal cord then, when it processes this, it stimulates the parasympathetic system because that's the one that's going to cause the vasodilation, whereas the sympathetic system will cause vasoconstriction of the arterioles in the penis. So you're going to get vasodilation with the parasympathetic. This one causes vasoconstriction. So basically, those arterioles of the penis dilate and the blood flows in. Now, as that is happening, those arterioles are making nitric oxide, and that's what you want to relax the arterioles, but you want to collapse the veins so that the blood does not flow out. So you're opening up the arterioles, you got increase in nitric oxide, and that's going to cause that engorgement of blood to cause that erection reflex, which occurs within seconds, maybe 20, 30 seconds. As long as that nitric oxide is there, what it's doing is increasing cyclic G and P. You probably studied about that when you studied about the eye, about photo reception of the eye. The cyclic G and P is going to increase as a result of the increase in nitric oxide. Okay? Now, as long as that nitric oxide is there and the cyclic G and P is there, the erection is going to ensue. It's going to be Okay, so based on that, talk about the male sex act, which we just said that erection reflex is both tactile and psychological, and it's a spinal mediated reflex, primarily activation of the parasympathetic system to get the erection. Now, the rest of this reflex is the climax, which would be emission and ejaculation. Emission is when the seminal fluids start to assemble with the sperm cells. And of course, ejaculation is the expulsion of the semen from the urethra. But emission is one of those curious things that can happen early on during the sex act, even prior to ejaculation, where the seminal fluids and some of the sperm cells come together, and some of them can be emitted or released prior to ejaculation. And so some people have used the withdrawal method and gotten pregnant, and it might be because of emission that has occurred early on prior to ejaculation. So that's just a little bit of physiology. Any questions about that? Okay. So we talked a little bit about erectile dysfunction, which is one of the major problems that men have maybe over 40, besides benign prostate hypertrophy or prostate cancer. We know that we just talked about how erection occurs. So one of the things is with erectile dysfunction, physicians use that as a diagnostic of heart disease. Because if you got vascular problems, it's going to lead to erectile problems. So they use that as a marker for heart disease. So when they come into the doctor's office, you may not be coming in with sexual problems, but if they suspect heart disease, they're going to be tested for erectile dysfunction. So we know that there are several drugs that are used to treat this. And these drugs also can be used to treat pulmonary hypertension. But, and so the Viagra was kind of discovered by accident in terms of it activating the erectile dysfunction, because they were looking for other effects in dealing with pulmonary hypertension and some of the other problems. And then they noticed that erection could occur. So all of these basically are blockers of phosphodiesterase. What phosphodiesterase does is breaks down cyclic GMP. So if you're not breaking down cyclic GMP, the erection stays. Okay? So you just block the breakdown of cyclic GMP with all of these drugs. Now, one of the things is that they tell pilots not to use it within so many hours of flying because you can alter vision. And we know that photoreception requires cyclic GMP, and you got to break it down to get your sodium channels open, and you don't have to know all of this, but hyperpolarize your cells. So one of the things is that you can get blurred vision with this when you're using it because of the effect of cyclic GMP being prolonged in the eye. So some individuals have even gone blind using this. Now the other problem with this can be priapism. Do you know what that is? Oh, yes, a erection that is much longer than necessary. That's when they come in to see you to say, I need some help, because it's very, very painful, as I understand. So this can promote priapism. Prior, P-R-I-A-P-R-I-S-M, priapism. So P-R-I-A-P-R-I-S-M, priapism.